I'm Dr. Lee Bihua. I'm a pediatrician and I practice at Mount Elizabeth Medical Center. Welcome all of you parents. It's very nice to be part of this parenting group. I hope I can be of help to parents out there, especially parents who have children with allergy problems or questions about allergies. I have interest in allergy, treating children with allergies and asthma. How can I tell if my child has allergy? How old should a child be for a full allergy test? What kind of tests are there? Well, allergy is actually an abnormal response to environmental allergens. Allergens we mean by inhalants, what is in the air, food, what we eat. And it is sometimes very difficult to differentiate allergies from other disorders. For example, if your child has a constant running nose, you wonder whether it's due to infection or whether could it be due to allergies. If there's a strong family history of allergy problems, then there is a higher risk or higher chance that your child's symptoms are due to allergies. Any age, allergy tests can be done at any age. It does not matter whether the child is very young, but we usually would do an allergy test only if the symptoms are highly suggestive of an allergic disorder. What we test against will also depend on whether the child has symptoms, the exposure of the child and what symptoms he has. In terms of the types of allergy tests, you can either do it by a blood test or what we call a skin prick test. These actually test for immediate allergies and they measure antibody known as IgE. IgE is an allergic antibody, and when we measure this, we can tell what your child is allergic to. You need to be careful that there are also many other tests that may be offered. For example, online, they say that it is stated to be useful for allergy detection. However, we have to be very careful that these tests are actually recommended tests by medical professionals. My child has been having a running nose on and off. Could this be allergies? Will he ever outgrow his allergies? What should I do? Well, a persistent running nose may be due to nasal allergy. Other very typical symptoms are actually sneezing, repeated sneezing, itchiness of the nose, sometimes itchiness of the eyes as well as a blocked nose. And these symptoms tend to occur over a long period of time, sometimes triggered by dust or triggered by temperature change. These symptoms tend to go on for a long time. If it is a short period of time, then allergies are unlikely. The child will likely outgrow his symptoms, but nasal allergies may last a long time. Sometimes they persist even into adulthood, although they may improve over time. My child has allergy symptoms such as rashes, wheezing. I have a history of eczema. What can I do to prevent his allergies? How can I build up his immunity? If your child already has wheezing and rashes, he might already have allergy problems, especially with the family history that you have eczema. The chance that he has allergies is quite strong. And if these symptoms have been persisting for a while, the likelihood is very high. How to control his symptoms or prevent his symptoms? One is to understand the environment that may trigger his symptoms. The other is that you may have to rely on some medications as well as skin care for his rashes. His immunity is not weak, but if he has already allergies, then he has an overreactive immune system against some of these environmental allergens. If working with your doctor, controlling his symptoms will actually improve his health tremendously. Family history of allergies. What food can I give my baby to prevent allergies from happening? Should I delay giving seafood, eggs, nuts, and wheat? Well, the medical profession doesn't have an exact answer for you with regards to delaying allergenic foods. The foods that you mentioned are actually foods that are very common causes of food allergy. Right now, we would say that there is no point avoiding these foods as it has not been shown to prevent food allergies. Breastfeeding exclusively is highly recommended, but if that is not possible, then with a strong family history of allergies, mothers may want to consider using partially hydrolyzed formula, and these include formula that are available known as HA formulas or hypoallergenic formulas. My child has been diagnosed with atopic dermatitis eczema. He has seen many doctors who can only relieve his condition for a very short period of time. What can I do to help him prolong his eczema-free days? Unfortunately, eczema is a long-term condition. It's not something that we can cure or get rid of over a short period of time. Your baby is born with a skin disorder that causes dry skin, and it is very easily irritated. So it gets itchy and it gets red by anything that might irritate his skin. So a very important part of management of eczema is not to irritate his skin and to have daily skin care. Irritating factors, the most common of which are heat when it's very warm, strong soaps, so don't use strong soaps for bathing. In fact, we recommend soap-free cleansers. Moisturize his skin because dryness can irritate him and cause itchiness. And finally, his clothing. His clothing should be soft, and it should not be furry or hard or in texture, because that will irritate his skin. Sometimes you may have to rely on medication for his skin care, because when the rashes are severe, you need to treat those rashes with topical treatment. You also want to watch out for skin infections, which are obvious when the skin is broken and when there's weeping or discharge from the skin, because infection can also worsen eczema just like all the other irritating or irritative factors. Long-term skin care is very important, and if you manage this, you will find that there will be more days without eczema. And if you do this over the long term, you'll find that young children with eczema eventually improve tremendously. Thank you very much for listening to me. I hope my answers were useful to you. I look forward to our next session, and I hope this discussion will be as lively as this one. Thank you.